Hi everybody. About 15 to 20% of all pregnancies end in miscarriage, and this can really be a devastating and confusing time for moms and dads. Often parents are left with a lot of questions about why it happened. Well, joining me in the studio is OBGYN Dr. Shiva Gofrani with some answers for us today. It's great to have you here.
Thank you for having me.
Can you tell us, for starters, when miscarriages typically happen?
Well, the majority of them are going to happen in the first trimester. So that means somewhere between 0 and 13 weeks. And often in general, we tell patients not to come to the office until about 8 weeks because many of those miscarriages will actually have occurred before that 8-week period. And so patients aren't necessarily getting as emotionally invested, really, before they've come in.
Right. Still difficult at any time.
Still difficult at any time. But certainly, I think once you've seen the baby's heartbeat, it makes it that much more emotional.
Exactly. Now I understand why you wait to have us come in.
That's why.
I never knew that. Okay, so why do miscarriages happen? I know there are a lot of different reasons.
Typically just something bad occurred between the egg and the sperm. They didn't really meet in the right way. And the majority of all miscarriages are still going to occur because the chromosomes are abnormal. So something with the genetics wasn't the way it should be. And the vast majority are genetic problems.
So what are the chances of having a miscarriage, and does your chance increase as you get older?
Well, unfortunately, each year we get older, our risk of chromosome abnormalities like Down syndrome gets higher. So that's why you hear people say, oh, we want to get, you want to have a baby by the time you're 35, which is actually very untrue. But that was the old-fashioned way of thinking about it because each year, as you get older, your chance of chromosomes being abnormal is higher, and therefore your chance of miscarriage is higher. We still say overall the likelihood is 15 to 20%, but it does, again, increase as you get older.
So there are a lot of things going on with your body when you're pregnant that you're not used to, different feelings and pains, but are there any signs of a miscarriage that women should be looking out for?
Well, the clearest sign would be bleeding, and that would be a sign that you absolutely have to call your doctor and get checked out. A less worrisome sign is actually cramping, because many women think, if I'm cramping, I must be having a miscarriage, but cramping is actually a very common feeling in the early part of pregnancy.
I remember.
Yeah, and many patients call and say, I think there's something wrong, I'm cramping. Cramping without bleeding is very normal. Cramping and bleeding is a sign, again, that you should really get checked out, though even the cramping and bleeding can often be a normal sign.
Is there something or anything that women can do during pregnancy that can be putting them at higher risk? And is there a way to prevent having a miscarriage?
Well, there's certainly things you can do to put yourself at higher risk. I mean, smoking absolutely has been shown to increase the risk of miscarriage. They think high doses of caffeine might do that, so we should really keep our caffeine levels at 200 milligrams or less a day. And certainly other obviously toxic habits like doing drugs like cocaine. If you have health problems like diabetes or high blood pressure, it's good to kind of get those in check before you get pregnant. So those are the obvious things. To be fair, the majority of miscarriages, again, though, occur just because something was wrong with the genetics, and that really means you can't prevent it. And your second question was about, is there anything?
If you can prevent it,
yeah. I mean, again, the things to do are just make sure you're in your best health. Genetic problems are often not preventable. There are rare circumstances where we can find those problems in mom and dad and then go through infertility treatment to prevent it, but that's very rare. So in general, you have to assume that it's in your control to be in good health, and the other things you kind of have to leave up to something, something in nature.
Why is it that some women have, I mean, I spoke to a woman yesterday who said, I had 10 miscarriages in between having children. I mean, why is it that some women will have so many and some might not experience one at all?
Well, and again, sometimes it just has to do with the chromosome. So when that egg comes about, that egg might not have had the appropriate number of chromosomes when it met the sperm. When someone has 10 miscarriages, it's typically something more. So in other words, we said the most likely reason is genetic abnormalities, but there can be antibody type problems for patients. There can be other issues that can lead to difficulty carrying a pregnancy. Patients sometimes have the ability to create little blood clots, so that can be an issue. They can have problems with the shape of their uterus. So again, multiple miscarriages makes you think there's something more going on.
Once you've had a miscarriage, what happens then? Is there a type of treatment?
Well, if you've had 1 or 2 miscarriages, believe it or not, the recommendations are not to do anything differently, not to look for a reason and not to be too concerned because it's very common. So the kind of old-fashioned guidelines say we don't look for causes until someone has had 3 miscarriages. I think that obviously we all tailor that. Sometimes 2 miscarriages prompts us to do something. So if we find a reason, we can treat it.
And we're just about out of time here, but I just want to know how long you need to wait after a miscarriage before you try again.
And again, the hard part is there's no good studies, but we usually say about 2 to 3 normal periods after you've had a miscarriage before, just to let your lining kind of thicken up again and become healthy.
Doctor, so great to have you in the studio.
Thanks so much
Thank you
for having me.
clearing up a lot of misconceptions for us.
Thanks.
Appreciate it. Thank you. you. And if you'd like more information about pregnancy, you can check out our website at youtube.com/parentstv. If you have questions or comments, you can tweet with me at twitter.com/parentstv. Julie, thanks for joining us.